On today's Wellness Report, new numbers show America's obesity rate is finally dropping, and GLP-1 drugs may be playing a big role.
3 years after obesity hit a record high, the number of Americans considered obese has fallen to 37%. That's roughly 7.6 million fewer adults, according to new Gallup data.
The sharpest declines are showing up among people in their 40s, 50s, and early 60s, the same age groups using weight loss injectables such as Ozempic and Wegovy at record levels.
So having obesity increases your risk of cardiovascular diseases, including coronary artery disease, congestive heart failure, and heart attack and stroke. So what's their concern?
Yeah, doctors say the trend is promising, but obesity remains a major driver of heart disease and even early death. Just a small amount of weight loss and regular exercise can actually make a really big difference for your heart.
So here to tell us more about this is Chief Scientific Officer at the wellness company, Dr. Peter McCullough. Great to have you here, Doctor. Tell us a little bit about the findings here and what's the takeaway here for people at home?
You know, as an internist and cardiologist, I use these drugs in my practice. We're talking about GLP-1 receptor agonists. And they've been out for many years. They used to be once-a-day injections. Now they're once-a-week injections. There is an oral form available, not so well tolerated. And actually today, the CEO of Eli Lilly said that their oral drug now will be entering the market shortly. Hopefully it will be much better tolerated. They have large clinical trials showing not only reductions in weight, but control of diabetes and improved cardiovascular and renal outcomes. So I think this is very promising, but a recent analysis said about half of Americans would be eligible for these drugs. And so the question is everybody going to be on once-a-week injections? I don't think so. I think we're going to have better solutions.
Also, a lot of people say, okay, these are great, but obviously we know they're very, very expensive. And especially, a lot of people worry about potential side effects, but also, and doctor, tell me if I'm right, we're hearing that actually there are a lot of positive side effects that maybe were not expected initially. We're hearing things about potentially reduced dementia. Some people who have snoring problems, they are also being helped, of course. So again, lots of interesting additional benefits.
Let's take safety first. The concerns are, and they happen, but they're rare, pancreatitis, medullary C-cell tumors of the thyroid. Most of it is dose-related in terms of the symptoms. We have to start low and work our way up in terms of dose. But because weight is reduced, there have been studies showing, again, cognitive function, heart and kidney disease, actually joint disease. One of the primary outcomes of the recent oral drug is going to be, reductions in knee pain, for instance, knee arthritis, and of course, sleep apnea and other weight-related problems. So as body weight comes down, health outcomes get better.
Get your takeaway from this. According to Johns Hopkins Medicine, some ways to choose a weight loss treatment include the following here. We'll get to these points. Determine your weight loss goals, understand your current health status, consider the time, recovery, and cost commitments of treatment, consult a weight loss specialist or a bariatric surgeon. Your takeaway from that?
Bariatric surgery does work. It's used rarely. I think mainly internal medicine, family medicine, medical specialists handle this. It's been my experience that these drugs are used typically for about 9 months. Then we can taper it off as weight loss is solidified. We always need a diet with healthy choices, portion control, and exercise to make this weight loss stick.
All right. Dr. Peter McCullough, again, we just have less than 30 seconds left. But again, I love what you're saying here. Obviously, start by looking at all of your options. Of course, consult with your doctor if it is right for you. Then that might be something you want to do. But of course, technology going a very, very long way here. And again, reducing obesity is a very good thing and very healthy for a lot of people. Of course, we appreciate your being with us here, Dr. Peter McCullough. Thank you.
Thank you.